Good morning, everyone. I'm Lesley Briones, and I'm so thankful to be serving as your Harris County Commissioner for Precinct 4. Today fills my soul, not only as your commissioner, but as a former high school teacher. When I think about my students, many of them did not have access to medical care, and many of them had become teen parents, and the challenges they faced. And as a teacher, I tried to help in the ways I could. But if I could have had a Baylor College of Medicine teen clinic down the street in the underserved community where I was teaching, that would have been transformational. So today, I am so happy that you all are here to celebrate the opening of this Baylor Teen Health Clinic here at Bayland Community Center. I am so proud to live in Harris County, where people literally travel around the world to come get care at our hospitals. We have the largest medical center in the world, and we have one of the best. But we also know that in many of our communities, they don't have access to our medical center. So for us today, through the power of partnerships, to be bringing world-class medical care into the community in this Sharpstown, Gulfton area, where we know that approximately 40% of our community members do not have insurance, where we know that approximately 55% of the community is low income. This is transformational change accomplished through the power of partnerships. We'll offer physicals, immunizations, sick visits, mental health, behavioral health, STI, HIV prevention and screening, family planning services, contraception counseling, pregnancy testing, and more. And this will be free to our youth ages 13 to 24. Free, thanks to the partnership and generosity of Baylor College of Medicine, thanks to the amazing $100,000 grant that the Harris County Hospital District Foundation awarded us, and thanks to the Harris County Precinct 4 team members who helped make this possible and helped invest $400,000. And this will be self-sustaining thanks to Baylor College of Medicine after this initial seed investment. Again, transformational change for a community that needs it, and more importantly, a community that deserves it. When I took office approximately 2 years ago, this building that is now the beautiful, warm, and welcoming teen clinic was locked, vacant, had spiders, etc. Nothing was happening. So we are doing our best, and I want to thank again my Harris County Precinct 4 team members for making so much change possible, as well as the Precinct 4 Forward, which is our 501c3 public charity arm, and there's many Precinct 4 board members, 4 Forward board members here today. Thank you. Thank you for the transformational change you are helping to make. So we are trying our best to make Bayland Community Center a health hub. We will have this teen clinic. We have a partnership with Harris Health, and I see many of our Harris Health leaders here today. If we can give them a round of applause, as well as our board members, thank you. A telemedicine site here at Bayland, so folks that might have transportation access challenges and cannot get to one of our Harris Health locations can have a televisit here and start their journey towards wellness. We also have a partnership with Harris County Public Health, and I see some of our team members here, so we could thank them. Please. They are helping to lead a diabetes prevention program here at Bayland, as well as a dental clinic, a mobile dental clinic that they're hosting. We also have a partnership with Common Market. We're really trying to focus on addressing food insecurity. So we thank our partners at Common Market. We also have a partnership with Texas A&M Agriculture, a walk and talk wellness program here, social workers who are helping to connect individuals in our community to the services they need. And I want to thank so many community groups, including Madres del Parque, who have been a key partner we will be investing millions, and I thank Precinct 4 Forward because they will help us invest millions to transform this entire park so that the folks in Gulfton and Sharpstown have the park that they deserve. And we will also be doing the same just down the street at Burnett Bayland in the heart of Gulfton, our Ellis Island of Texas. This moves me again to my core as a mom of 3, as a former teacher, because I think of my students. Fast forward many years, the fact that we can join forces as partners across Harris County, but here in particular, where my heart is, in the Sharpstown Gulfton area, to deliver this to the community moves me deeply. And I look forward together to continue marked progress, because together we will build the resiliency and the wellness so that all in our community can thrive. So I'm profoundly grateful. There's so many people here that I'm looking around, and so many of you made this possible. So my profound gratitude. I especially want to thank again all of our Baylor College of Medicine partners. We will hear next from Dr. Paul Klopman, but I also want to take a moment to thank Dr. Peggy Smith, Dr. James McDivitt for their leadership. And this was record time for Harris County Speed, because all of us do not work on government speed because the people have been waiting. So we are blessed to have your leadership, not only transforming Harris County and Texas, but the entire world. And congratulations and thank you for everything you do. And we will also hear from my Texas State Senator, our Texas State Senator, Senator Molly Cook, who is on the front lines of delivering wellness to our community. So very briefly, I will not say all the remarks in Spanish, but I appreciate Spanish media, and then we will move to Dr. Paul Klopman. Buenos días a todos. Soy Lesley Briones. Soy su comisionada del Condado Harris, Precinto 4. Y quiero dar las gracias al Dr. Paul Klopman, presidente y CEO de Baylor College of Medicine, a la doctora Peggy Smith, CEO de Baylor Teen Health Clinic y miembro de la Junta de Harris County Hospital District Foundation, al Dr. James McDivitt, vicepresidente de Baylor College of Medicine, a la senadora de Texas, Molly Cook, y al representante Jean Wu, que en unos minutos ojalá va a venir, y a todos ustedes, porque hoy estamos celebrando algo muy importante para nuestra comunidad aquí en el Sharpstown y Gulfton, en esta zona. La atención médica de calidad es un derecho para todos, pero sabemos que muchos no pueden acceder a ella. Estamos trabajando en equipo para ampliar el acceso a estos servicios. Y estoy muy feliz de desarrollar este trabajo aquí en esta zona de Gulfton, Sharpstown, en el centro comunitario de Bayland. Como mamá de 3 hijas, yo fui también maestra, y para todos esos estudiantes que no tenían el acceso que merecían en esos años, aquí estamos ahora. Y estos servicios son gratis para todos ustedes y estamos aquí para servirles. Sabemos que en esta zona más de la mitad son de bajos ingresos y casi la mitad no tienen seguro médico. Con Baylor Teen Health Clinic traemos atención médica de alta calidad a la zona totalmente gratis para nuestras familias. Este centro tiene servicios gratuitos y bilingües para jóvenes entre 13 y 24 años. Ofrece atención preventiva, mental y de salud reproductiva. Y también cuenta con laboratorio y farmacia. That's one thing I didn't mention in English. We have our own laboratory and pharmacy here, which I think is amazing. El Precinto 4 invirtió $400,000 para financiar la clínica y la Harris County Hospital District Foundation dio $100,000 más gracias a un donativo para servicios de salud mental. Porque con este y otros proyectos aquí en el Centro Comunitario de Bayland, queremos convertir Bayland en un gran destino para la comunidad, porque eso es lo que nuestra comunidad merece. Muchísimas gracias. Estamos en esto juntos y juntos vamos a seguir el progreso que nuestras familias merecen. Welcome de nuevo, muchas gracias y ahora vamos a dar la palabra al Dr. Paul Klopman. Please help me welcome the President and CEO of Baylor College of Medicine, Dr. Paul Klopman.
Well, good morning, everyone, and thank you for taking the time to come out this morning. Baylor College of Medicine arrived in Houston about 75 years ago as the founding member of the Texas Medical Center. And over the last 75 years, we have focused on becoming a major pillar of the community. In fact, so much of what we do is really community-based. We are known for our cutting-edge research and our clinical care and our medical school and educational programs. But in fact, it doesn't mean anything unless we can deliver those resources to the community. And our community is Harris County, Texas, in the United States, but also internationally. We have programs all over the world with the same thing in mind, bringing cutting-edge research and medical care to communities that are underserved. And this is a great example of exactly what we want to do in the county. That said, none of this can happen without the vision of a leader like Commissioner Briones. We've been around, and this hasn't happened until she arrived. And I really want to stress it. And when people think, particularly during this particular season of elections don't matter. Well, they really do matter. When you elect an official who not only has a vision, but has the wherewithal and the can-do attitude to actually accomplish something, this is what happens. So we can't do any of this without partnership, as you mentioned. And having a partner like the Commissioner Briones is just a great thing to happen, not only for the community, but for the Baylor College of Medicine, because this is our mission. This is what we're here to do. We don't sit in an ivory tower just trying to think of great thoughts. We want to be out in the community, improving the health of all of our citizens. And some of the most underserved citizens are teens. They are really often forgotten. I mean, there's programs for children. There's certainly programs for adults, but teens, those middle school kids, they're often forgotten and left out, and they are some of the most important people. Attitudes for life often develop in that 5th, 6th, 7th, 8th grade period of time. And this clinic will serve them, and I hope this will make them better adults and be pillars for our community, for this community, and for Harris County and for the country. So I'm deeply honored to be here. Again, it couldn't have happened without the vision of Commissioner Briones, and I'm really, really grateful for her partnership, and I hope she stays commissioner for a long time. And I will turn it over to Dr. Smith, who is the heart and soul and emotional leader of our teen clinic.
Thank you, boss. Good morning. I am humbled and honored to have this opportunity to bring the best that the Texas Medical Center and Baylor College of Medicine have to offer to a community that really needs it the most. Reflecting, there are several things I want to share with you. The first is transformational. When people want to make a difference, they do it quickly and they do it effectively. And I want to thank Commissioner Briones. It was not too long ago in April that Mr. Buttram met us at Wisdom High and looked at the population that lacked services. And Dr. Briones saw that it was not only the Wisdom High population, but it was Precinct 4 population that really needed this service in their neighborhood where they could get it without cost and without problems. So I want to thank Dr. Briones. She is rocket science in terms of moving something forward in less than 4 months. And thank you, Mr. Buttram, for helping this make that happen. I also want to say, to me, this is truly the proxy of what partnership means at Baylor College of Medicine. And more importantly, Baylor has a fourth pillar. It's community. And this is community for us as well as community for you. So rest assured, we are committed to make this very exciting, to expand. We've also started planning some more issues as it relates to behavioral health and services. So stay tuned. We're just this is from my heart. On behalf of my staff, my staff is here. Can you stand up, everybody? Come on, stand up. Don't be shy. I get the credit, but these are the people that do the work and deal with the problems and make it happen. So I want to say, on behalf of all of our staff and who are be here and be responsive to your participants and your constituents, on behalf of our staff, but more important, the patients that we serve. Thank you. We're just beginning. Come see us. Thank you. And now Dr. McDivitt will also give remarks. Dr. McDivitt.
Thanks, Peggy, and thanks everyone for being here. Everything's been said, but not everyone said it, so I'll echo some of Dr. Klopman's remarks. I'm very happy to be here for a number of reasons, and I'll start by again echoing my thanks to the Commissioner. Oftentimes, the political leaders that build these projects are tangentially involved. They're at executive level. They're sort of directing and moving the chess pieces around. That was not the case in this project. Commissioner Briones was involved on the ground at every level of the project. It literally would not have happened were it not for her leadership. So thank you for that. You're the reason we're all here. I am happy to be here today because Baylor College of Medicine, the physicians of the Baylor College of Medicine, we do represent the premier academic physician group in the city of Houston. And Paul talked about our great research. We have tremendous educational programs. But beyond that, we are the only medical group in the city that takes care of the entire city. We care for veterans. We care for children. In our partnership with the county, we take care of the economically disenfranchised in the county. Actually, even if you have health insurance, we'll take care of you if you have health insurance. But there is no part of this community that the Baylor College of Medicine does not touch. We want to take care of you. We want to take care of your friends. We want to take care of your family. And an important piece of that is the teen health clinics. I've been here for 11 years now. Peggy was one of the first people I met when I came to Houston and learned about the great work she has done now for 52 years. So thank you to Peggy. It's interesting when you look at this piece of land that we're standing on. I'm told that it was originally a orphanage for Civil War orphans. So what an interesting arc of history that a piece of property that started taking care of young people in tremendous need has now evolved into something to take care of young people with tremendous needs. And that's what Teen Health Clinics does. Provides for the health care of adolescents, providing good sexual information and in an unbiased way. And as everybody knows, good information now is sometimes hard to come by, and care that occurs in a confidential and safe environment, as well as behavioral health needs and behavioral and psychiatric issues, which unfortunately are more and more common in the adolescent population. You can't have a healthy community without healthy adolescents, and that's really what Teen Clinics is all about. The clinics really ring Houston. If you drive around the 610 loop and you look to your left, to your right, you're going to see a location somewhere for teen health clinics. But this really does serve a underserved region. Houston fills in a nice part of the geography. I will finish by highlighting a couple of programs. We've talked some about Teen Health Clinic and what it does, but specifically, we have a program called Ascend. And on top of the other things we talked about, Ascend helps to take adolescents from underserved communities and link them to healthcare professions and try and develop them to become providers, to become the future nurses and doctors taking care of the community. So a really, really critical program. The Northeast Adolescent Project, or NEAP, provides unbiased information to the community regarding sexual health and tries to improve the level of knowledge of sexual health in the community. And lastly, the Texas Nurse Family Partnership is a really interesting program that takes registered nurses, links them to low-income first-time mothers, helps to improve their delivery of prenatal care, and also does some work with young children and child development. So all really great programs that have a substantial impact on the health of our community and the adolescents in our community. So thanks for everyone for making this possible, and I will bring up to the podium, I think, Commissioner Briones.
Thank you, Doctor. Thank you so much. Can we hear it for our three amazing doctors and leaders? Now, would you help me welcome Texas State Senator Molly Cook.
Good morning, and it is an honor every single time I get to stand beside and behind Commissioner Lesley Briones. I am so proud to be the state senator for this district, to share constituency with her, and to be bringing a public health lens into the Texas State Senate. And I can tell you that it gives me joy, it lifts my spirits, it puts wind under my wings to know that our local leaders, like Commissioner Lesley Briones, with her vision, with her tenacity, with her incredible team, are prioritizing public health and prioritizing the health of the most vulnerable people that we both get to serve. And it's exciting to me, as your state senator, to know that we're fighting at the Capitol, we're fighting at the federal level, and we're fighting right here on the local level for every single one of the patients that this clinic will serve. And I also want to say thank you to her team, and to every single partner here today as an emergency room nurse. This is exactly what we need to stop things from getting to the point of an emergency and landing in a desperate situation in my department. This is exactly what my colleagues who are serving at Texas Children's and Memorial Hermann are desperate for, to address the rise in the mental health crisis in exactly this age group. So it moves me to tears to be able to stand here today and say thank you, thank you, thank you. This means the world, and it's very exciting to see this progress happening in Harris County. Thank you, Commissioner Briones.
Thank you, Senator Cook, for fighting for us in Austin. And also thank you to Senator Miles. We have a representative from his office. Thank you for everything you and your team, Justin and the senator, do to fight for us. So we are thrilled and thankful and look forward to continuing to build on this progress for the health and wellness of all of our community. So please join me once more in thanking Baylor College of Medicine for their partnership, and we have a tiny token of our deep appreciation. So.